One of our strategies, a key factor probably, is trying to expand the point of care strategy to set a production unit in every hospital that is participating in the program. Planning to add at least 3 other centers with the possibility to manufacture the T cells, not only to perform the apheresis and to treat the patients. And I think that with this decentralized system, to guarantee the number of cells that the patient that can be treated with these cells every month could be more real. We have to work together. Not only we have to work together in order to improve this field.